Hey everybody, today we are going to talk about the cardiovascular system. This is going to be part of the series of anatomy and physiology that I have. So I have those on a playlist so you can have them all in one spot. There will be two parts to this. This is part one, talking about the functions and the structures of the heart and the blood vessels, which is basically all the cardiovascular system is. And as always, before we get started, if I could please ask for you to hit that like and subscribe button if you haven't already. It really helps me out. I really appreciate it, and it is free to subscribe. So let's go ahead and get started here and talk about the introduction to the cardiovascular system. So the cardiovascular system is comprised of literally the heart and blood vessels. That's it. Um, I've always joked about how complicated this system is for as simple as it is. Okay. Granted, the heart is very important to us. We couldn't live without it. However, um, it is literally just an organ and granted miles and miles and miles of vessels. But that's really it. So what is its job? Well, its job is very important. Its job is to circulate oxygen, nutrients, and wastes in and out of the body and to the various tissues and cells and anywhere that they're needed. So very big job that the cardiovascular system has. And if something goes wrong, it can really throw a wrench in your day. But it is fairly simple for as complicated as it is. And I will try very hard to make sure that I can describe this in the easiest way possible for you. All right, so let's look at the layers of the heart. And I do realize that I have made a typo here. Yes, it happens even to the MA mentor. Um, but I will point that out here when I get to it. So the layers of the heart are as follows. We have the pericardium, okay, which is the outermost portion or surrounding sac, so to speak, of the heart. In this diagram, it's this kind of grayish blue area here. There is a little cross section to make it a little bit bigger right here. And the pericardium is actually split into two different layers. One is the fibrous layer, which is the outer layer that you'll see right here. And there's the serous layer, which is the inner layer, which is also then divided even further into two more layers. Yes, because this is medicine and it can't be simple. The parietal layer and the visceral layer. The visceral layer is actually known as the heart wall and is also known as the epicardium, which is what this should say, not endocardium. So the next layer in from the pericardium then is the epicardium. The epicardium is therefore cushion. It is the actual heart wall. Okay. Um, right below that is the myocardium, which is probably the like the heavy lifter. The myocardium is muscle. And because our heart beats constantly, the myocardium is very thick, very important, very strong because it has to constantly contract and relax and contract and relax to beat and pump blood. And then the innermost layer is then the endocardium because endo means in. Okay. All right. So the other features or characteristics or pieces and parts, so to speak, of the heart are these. So let's start with the vena cava. So the vena cava are basically just giant veins. And when we get into describing veins versus arteries versus capillaries, um, you will note that veins bring blood to the heart and arteries take it away. So we have a superior vena cava and an inferior vena cava. Up, down, top, below. Okay. Um, Those are huge veins that are bringing blood from the body into the heart. And you'll note too, in any book you see, any diagram you see, anything, that most drawings or diagrams that depict veins or the heart or anything cardiovascular will have red and blue. This has more of a kind of a orangey pink, but anytime you see blue, it's because it is carrying deoxygenated blood, so blood with no oxygen. And anytime you see red, it's carrying oxygenated blood. It's not that our blood is actually blue inside of our bodies, okay? It's just depicting deoxygenated versus oxygenated blood. And yes, it makes sense that the vena cavas would be bringing deoxygenated blood in because the body has used it all up and is coming back to get some more. Then you have on both sides of the heart here a set of pulmonary arteries and pulmonary veins. Those take blood to and from the lungs where they pick up the oxygen, which we'll talk about here in a little bit. You have this huge vessel right here. This is the aorta. The aorta is just a giant artery, basically, and has a bunch of branched off arteries like the subclavian artery, the carotid artery, the brachiocephalic trunk, that inevitably branch out and go to the various parts of the body to carry oxygenated blood to them. Then on the inside of the heart, you have four chambers. And those four chambers are the top two are called the atria or atrium, singular. The bottom two are the ventricles or ventricle, singular. In between the atria and the ventricles, you have valves. Okay. So on the right side, and remember, this is your patient's right and left. So I know on the picture, this looks to be the left side, but it's really the right side of the heart. Between the right atria and the right ventricle, you have the tricuspid valve. On the opposite side, between the left atrium and the left ventricle, you have the mitral valve, or sometimes it is referred to as the bicuspid valve, but more commonly the mitral valve. You have a division down the center here. That is called the ventricle septum, or ventricular, sorry, septum. You also have, and it's kind of behind here, but a septum that divides the atria from one another too, from right and left, and that is the atrial septum. Then we have a valve that leads to the aorta, called the aortic valve. Go figure. And another valve that leads here towards the pulmonary arteries called the pulmonary valve. Now, valves are super important in the heart, and we'll see why here in a little bit, but valves are super important because they are one way. You don't want the blood to flow backwards because that can cause some problems. So all of these valves are one-way valves. Now, do they cause or do they allow for some backflow every once in a while if they are dysfunctional? Absolutely. And that we'll talk about in part 2 when we talk about disorders. But for the most part, they are one way and usually work pretty well. Okay, so let's talk about the flow of the blood through the heart. Okay. All right, and here's where we get the blue and the red going on. Okay, so blood is coming from the body. When blood comes from the body, it is used up. It's still blood, but everything that blood was carrying has been used up. Oxygen, nutrients, all of it, okay? So the blood is coming in through the superior and the inferior vena cava, okay? All the blood from the head, like shoulders up, come in through the superior vena cava, and then all the blood from the body comes in through the inferior vena cava. That all goes into the right atrium, okay? Then And keep in mind, the heart is beating continuously. Boom, 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 boom. Okay. As this blood's flowing into the right atrium, it gets squeezed when the atrium contracts, and the atrium contract together, and the ventricles then contract together. And that's what causes those noises, sort of, that timing anyway. Once the blood enters into the right atrium, it gets squeezed down through the tricuspid valve and into the right ventricle. By that time, the atrium have relaxed and the ventricles are contracting. So when the ventricles contract, that blood then gets squeezed or pushed up in through the pulmonary valve and into the pulmonary arteries, left and right. Okay, so left pulmonary artery, right pulmonary artery. That blood then gets, and it's deoxygenated, remember, because it's blue, um, gets pushed out into the lungs. Now, when we go through respiratory, you'll find out what happens then, but basically what happens is the blood, as it's flowing into the lungs, is picking up oxygen that we've breathed in, okay? It's also dropping off carbon dioxide because carbon dioxide is a waste product. And because our deoxygenated blood doesn't have oxygen but is carrying carbon dioxide, we need to get rid of that. So as it picks up the oxygen, it drops off the carbon dioxide into the lungs, and then we breathe that out. Okay. Meanwhile, that now newly oxygenated blood is coming back from the lungs through the pulmonary veins. Because remember, blood comes to the heart through veins. So here you have your left pulmonary veins, here you have your right pulmonary veins. So it comes out of the lungs, nice and oxygenated, and back into the heart through the pulmonary veins and into the left atrium. When the atria contract again, that blood gets pushed through from the left atrium down through the mitral valve into the left ventricle. Then the ventricles contract, and that nice new oxygenated blood gets pushed up through the aortic valve into the aorta. And from the aorta, the blood gets distributed through the body. And that happens every boom, 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 everyone. Okay. And for an adult, a normal average heart rate, or how many times your heart beats, is 60 to 100 times a minute. Okay, a minute. And there's 60 of those in an hour and 24 of those in a day. So here is why we have to take care of our heart, because it works so hard. It works so hard. But think about how many times this happens just in a day, much less than a lifetime. Okay, so one more time. Deoxygenated blood in through the superior and inferior vena cava into the right atrium, gets boom, or gets boom, pushed into the left ventricle. Boom, gets pushed into the pulmonary arteries, left and right, out to the lungs, where it drops off oxygen or drops off carbon dioxide, picks up oxygen. That oxygenated blood flows back in to the heart through the right and left pulmonary veins into the left atrium. Boom, gets squeezed down into the left ventricle. Boom, gets pushed up through the aortic valve into the aorta and whoosh out to the body. That's how blood flows through the heart. Okay, so what do these things sound like? I keep going ba-boom, ba-boom. A lot of books will describe it as lub-dub, okay? Um, and what actually makes that sound? It's not the contraction of the aorta or the ventricles or anything like that, as people think. The sound is actually being made by the valves slamming shut. So every time those valves slam shut, that is what you're hearing. Okay. Now, in a normal heart, nice, normal, regular heart sounds, it will sound very normal, like we always think it does. Sometimes, however, as I had mentioned previously, those valves can become dysfunctional and maybe not slam shut like they're supposed to. Okay. And that is what causes a heart murmur. Okay. So that first sound that we hear, that boom, is the ventricles contracting and the tricuspid and the mitral valves, the ones between the aortas and the ventricles, or I'm sorry, not aorta, atriums and ventricles, are slamming shut. The second sound, the boom, is when the ventricles relax and the pulmonary and aortic valves shut. Okay. If those valves are damaged, though, they're not going to close completely, and that is what will result in a murmur. Okay. And a murmur, when you hear it, sounds more like a washing machine. So I've got a couple of audios here for you. This is a normal heart sound. Oh, okay, so that's a normal heart sound. This is a murmur. That's kind of a swishing noise. Okay, and that's the difference between the valves slamming shut like they're supposed to and them being kind of wobbly. Okay. All right. Oh, there we go. Okay. Gonna start beating again. All right. So that is what happens when the blood flows through. Now, our cardiac muscle, if you watch the muscle system, our cardiac muscle is its own type of muscle. It's found nowhere else but in the cardiovascular system. It is involuntary, though. Skeletal muscle is voluntary. Skeletal muscle, we make move, or we can stay still. Cardiac muscle is not a voluntary muscle. It just happens. Okay. Thank God, because we would die in our sleep if we had to think about our heart beating, right? So, what causes it to actually contract and relax so that it can keep beating? That is electricity. Those are electrical impulses that come. And that is called the conduction cycle. Okay. This is also what gets picked up on an EKG. This is what an EKG measures, is the electrical activity of the heart, not the muscular part, because there would be no way to measure that. Okay. So here is how the electrical conduction occurs. Now, this has nothing to do with the blood flow. It helps to move it along, but this is all electrical impulses. Okay. So the electrical impulses start right here with this little node called the sinoatrial node, or the SA node. The SA node is what is considered or referred to as the pacemaker of the heart. It's also where when they would have to implant a pacemaker, an electrical pacemaker. an artificial pacemaker, is if that goes bad, because that is what initiates that first electrical impulse. And without it, the subsequent impulses can't happen. Okay. So the SA node fires. It then goes, and it is right here up in the upper right-hand corner of the right atrium. The electrical impulse then goes down to the AV node. Okay, and right there, there's a slight pause because now everything needs, the atria need to relax and the ventricles need to contract. Okay, so slight pause, and then that electrical impulse goes down through the AV bundle, or what they some books refer to as the bundle of His, HIS, bundle of His, follows down, and then this is where that splits off, okay, into what we call bundle branches. So you've got the right bundle branch and the left bundle branch. Those bundle branches split off right there at that ventricular septum. Okay. Those impulses then follow those bundle branches down and then go out to the, oh, I am so sorry. I just clicked. I'm sorry. Go out to the left, go out to the right into what they call subendocardial branches, or what has always been known as Purkinje fibers. And that is how the electrical impulse flows through the heart to be able to cause the heart to contract, contract, contract. Okay. So let's go back through this one more time. SA node fires to the AV node, slight delay, down through the bundle of His or the AV bundle, to the right, to the left, bundle branches through the Purkinje fibers, and boom, boom. Okay. That is the conduction, electrical conduction system. And between that and the flow of the blood, this is how our heart beats and squeezes that blood out to the rest of our body. All right, let's talk about blood vessels. Okay. Without the blood vessels, the blood would go nowhere. So we really need the blood vessels. So I had talked about the difference between an artery and a vein. Okay. Arteries carry blood away from the heart. They are strong, they are thick. Okay. Because they're carrying blood away from the heart, that means they're carrying it from the heart, and the heart is pumping that blood, which means there is pressure on them. Okay. So that's why they're a little thicker, a little stronger, because they've got that pressure. And notice the structure of the artery and the vein are very similar, and they both have an outer layer, they both have smooth muscle. But then the vein just has this inner layer where the artery has an elastic layer and then the inner layer, primarily so that it can stretch slightly under that pressure. And quite honestly, that's how we feel a pulse. So when we're feeling for a pulse, like on the wrist or here, what you're feeling is the not only the blood pumping through the artery because it's coming directly from the heart, but that little bit of a stretch in that elastic layer that's allowing that to happen so that they don't burst. Because sometimes they're under so much pressure that if it didn't have that little bit of give like that, they would burst. And we'll talk about that. That's actually an aneurysm, but we'll talk about that later. Okay. So there's your artery. Your vein also has, it doesn't have the elastic fiber, but it has valves because blood in a vein needs to go only one way. Okay. You don't want it to back up. It needs to get to the heart to get oxygen. So strongest and thickest blood vessels are the arteries. They carry blood away from the heart. Veins carry blood towards the heart. They are thinner walled than arteries and they contain valves. But then you have capillaries, and capillaries are the smallest of the vessels. They're very thin walled, and capillaries usually wrap around things because one thing capillaries can do that arteries and veins can't is allow substances to move through them, through their walls. So with the example of when the deoxygenated blood goes into the lungs to pick up oxygen and drop off carbon dioxide, that's why it can do that, because it eventually flows into a series of capillaries that allow that oxygen to pass into the blood and that carbon dioxide to pass out of it back into the lungs so we can breathe it out. Okay, so that's the feature of capillaries. All right, moving on. Here is the systemic and pulmonary circulation schematic, so to speak. Okay, so here are the lungs. Deoxygenated, oxygenated, okay. Deoxygenated, oxygenated, deoxygenated, oxygenated. So basically what's happening here is the deoxygenated blood is coming up from the whole body, so the systemic circuit, into the heart. It's then going out into the lungs to pick up that oxygen and to drop off the waste, the carbon dioxide. Then it comes back from the lungs nice and oxygenated, so red, right? Okay. Goes back into the heart nice and oxygenated, comes out through the aorta, and then goes into the body, where it happens all over again. That's why it's called a circulatory system, because it just keeps circulating. Okay. Happens all over again. The body uses up everything that's in there, including the oxygen, becomes blue again or deoxygenated, and has to go right back to the heart to go to the lungs to pick up the oxygen, to drop off the carbon dioxide, to go back out into the body again. And this just keeps happening all day, every day. Okay. So there you go. Okay. That concludes the circulatory system basics. Thank you so much for watching. And we are going to have a part 2. So I do look forward to seeing you for that. If you did not already, please hit that like and subscribe. And as always, in the comments, if you want to see me do anything else, if you have any suggestions or things you're having trouble with, please let me know. And I will work on getting that content to you. All right. Take care, and we'll see you in part 2.